The rebuild and revitalization of the local county medical society is not for the faint of heart. My leadership project is to create a blueprint or roadmap for successful revitalization of the local medical society by sharing key successes of thriving societies. The local medical society is the lifeline of support for the physician in the community. My passion is for every physician and PA to be connected to and involved in their local medical society and our state medical society. What does that look like for our state? Our state has 30,000 licensed practicing physicians and 8,550 physician assistants. I love this map because it shows all of our county medical societies. In the dark blue are those that are active, but it also shows the light gray are the inactive, and that's where we need to concentrate. Of course, this is the recent data. As of September, we have 7,200 paid members, with mostly 3/4 male, 1/4 female. Most membership is in Region 2, and the age group breakdown is mostly 45 to 54 as the predominant age range. So for physician data, all the categories, active and live members, we have 6,465 physician members out of the 30,000 plus. That's about 21%. Of our PA members, we have 667 of the 8,550, or 7.8%. Well, we have a lot of growth potential, right? So for my project, I did want to speak with those societies who had seemingly success stories and just kind of compare them as we were growing our medical society in Robeson. So Region 4, I started with Western Carolina Medical Society. They have 16 counties in that group with over 700 physicians and PAs. Speaking with Dr. Rachel Keever, she's chair of the board of directors for that group, she stated that the Western Carolina Medical Society was designed to serve the community and not the member. And that contributes to their high membership rate. Of course, the benefits that they have, most coveted, they provide a program called Healthy Healer, which gives each medical provider 6 free visits with psychological experts. That's pretty cool. They also have food delivery service discounts, banking and mortgage discounts, and they have some really strong affinity groups like the Women's Affinity Group. And they continue to have their big social activities. So we go from Region 4 to Region 1, down with Pender, New Hanover County, and, just met with the phenomenal Bonnie Brown. In-person meetings, we had Zoom meetings. She was incredible with her 39 years of experience. She's been the cornerstone of growth of her organization and physician camaraderie. She feels her group meetings and the community engagement keep her physicians and their families connected. Other areas, and I kind of just put them in the map as well, that are regrouping and revitalizing was Wayne County with Dr. Dave Talo and Columbus County with Dr. Kahai. Now, Dave's approach is to connect with the UNC Physicians Network on the East, and he has lots of conversations with them to try for that group to support the physicians and PAs in there with their societal dues at the local and state level. Dr. Kahai is using the approach, they are meeting quarterly, but her group really just wanted to be pretty simple, meet quarterly, but also have one focus, and her focus is an annual CME program for the opioid component of the DEA. So that's what they're strategizing to do. Robeson County is the largest county in the state, close to the bottom of every health indicator possible, 99 and 100, depending on your year. The Robeson County Medical Society has a rich history. It was established in 1882 informally, but formal documents say that we were incorporated in 1903, 120 years, so that's awesome. I returned to Robeson County to practice and finally opened my own practice in 2010, and this started my deep dive into everything North Carolina Medical Society, from the Community Practitioners Program to the Foundation, to the Healthcare Leadership and Management course, and now the Leadership College. It was out of these experiences that my desire to bring my colleagues together more formally emerged. We were blessed. I'm blessed to just have friends everywhere. And we wanted to get together all our friends from the Scotland and the Robinson groups. And in January of 2020, we had a mixer of both of the organizations. And on the campus of UNCP with Chancellor Robin Cummins, but our keynote speakers were Drs. Jim and Michelle Jones. And it was just incredible that they got to speak to the group. We had over 80 folks there speak to the group about the society, state society membership and what that meant to be a local person. And this really spearheaded both of the groups' interest in kind of coming together. And then what do you think happened? COVID happened. So it was kind of in lull for a year and a half, but we did do some activities in 21, but we revamped in 2022. This year, 2022, was about the rebuild, small focus group dinners, member recruitment. We had a death of a colleague from suicide in the spring of 2022, which brought many of our physicians to our provider wellness lecture, and some reconnected as a result. Meetings were a mix of monthly Zoom and in-person quarterly. This October meeting took us back to the campus of UNCP for an institutional update, and Chancellor Cummings really invited us to be mentors, to be in their mentorship program, and we had 5 physicians who committed to that, so that was awesome. As we, still thinking about expansion and encouraged about increasing membership, we tried again for a second mixer for Scotland and Robinson physicians. But between COVID and other illnesses, we had one physician from Scotland, but it was a cool event. We had a nice jazz band and good camaraderie from our Robinson folks, so it was a great meeting. But there was not interest from the Scotland folks, so next meetings, we just decided, okay, we're just going to table that and concentrate on our Robinson growth. So from May, June, and July, we really did work on logistics of the society, logo development, web design, bylaw redo, and we resurveyed our membership to address the needs, what did they want to do in the next 6 months to a year. This is our logo, and many thanks to Gary Linton from the Medical Society for helping us to get to this point. It was a lot. We really appreciated it, and all the members were pretty pleased that we had something going forward. So from the survey results, our members wanted to connect with their families, and they, just kind of wanted something outside of medicine. So we made a family day, and again at UNCP, seeing a nice game. Chancellor Cummings let us use the Chancellor box and the tent, and we got all the food we wanted and all the beverages. It didn't cost our group anything, so it was incredible. And the members really had a great time. In regards to what the community outreach we were able to put together, we did a mental health awareness 5K, and we partnered with our Robinson Roadrunner colleagues. And this was to commemorate Jeff, and he was a great ENT. And our physician membership really they went all out. We had one champion, which was one of his best friends, and they did all the logistics, all the sponsorships, all the t-shirts, everything. We had 41 runners for this event, which was awesome for our first time, and we raised about $5,050 that we will be presenting to North Carolina PHP at our November meeting, so that was awesome. So our strategies, what were our core strategies? We actively recruited new members to build and enhance strong relationship with other local healthcare organizations. Expansion is only possible with strong leadership and governance, and we incorporated advocacy and community engagement. And this last part, we really, I want to continue the work that the society started with our county medical society members when we had a Zoom meeting of all the leadership from the different county medical societies. It was awesome. So that was a really key component in our growth. So our next steps. To be successful, the big ask. There is a need for membership accountability and access to real-time data to support membership recruitment and retention. In regards to state and county membership, make it an automated process. Remove the subscription options to only opt out once opted in. This will minimize lapses and drops. Physician collegiality with the local with the local society affords matters. It contributes to wellness and burnout prevention and grows our profession through mentorship opportunities. Our next steps, Robeson County Medical Society currently has 24 members, up from 15. Of those, 14 are female, so we have about 58% of ours that are female. We'll continue pursuing that group with Girls Night Out and connecting with this young physician families in whatever support we can do. We're really going to push as well for the 38 North Carolina Medical Society members who are state members but not local members. I'm going to hound them like crazy. Plans are underway for meeting with residency programs and encouraging them to join the medical society. The saying goes, many hands make light work. We really need all our colleagues at the table. I hope some of our strategies and takeaways from this project can help other county leadership in the pursuit of increasing their membership, because membership matters. And I challenge each one of you, each member, recruit a member. Thank you.